So hi again, and yeah, I am pretty late, and to tell the truth, I was literally surfing Instagram and trying to promote myself, basically. Or no, yeah, I mean, I can't even say promoting because this is just an accountability, step. So let's directly get on with what we are supposed to do for this session. So the first thing is, yeah, I did a little bit of studies I did do, okay, like around 30 minutes, okay, around 30 minutes. I just took to do the 10 questions on Fawzia sheet, and yeah, so what I want to say is that this is a pretty high content for MRCS, but then the type of questions they basically give is similar to NEET. I mean, it's pretty similar to NEET. If you just look at, like, if you just look at this question, for example, something like that, if you just look at this question, I mean, which neet-pg GT doesn't give pheochromocytoma? I mean, you tell me. So this is like, if you just look at this, I mean, just take a look at this question, okay, like a tall 25-year-old woman presents to the surgical clinic with complaint of swelling in front of her neck in the past 4 months, and then she has this vanillin mandelic acid and serum calcitonin is raised, and all these things, like points at, and most likely cause of hypertension, everything points at pheochromocytoma basically. So a lot of these questions, I mean, this is just one example, okay, and it's very similar to neet-pg. So basically my strong subjects are anatomy and surgery. So like, in a way, okay, like at least my surgery is strong. Anatomy, okay, I do make mistakes and I do forget, but surgery is something that I love studying. So this basically is my sanity, because I like that focus of having only surgery being tested on the papers. So that's the only reason I solve it, and apart from that, it's pretty beneficial for neet-pg also. I mean, you can check it out if you want to. So basically what I need to say is, like, the 10 questions in Fawzia sheet which I did was supposed to be from 31 to 40, okay. So today was 31 to 40, and I got consistently, so the first 10 questions I had got 5 questions out of 10 correct. The second 10 questions I had got 6 out of 10. The next set of 10 questions I got 6 out of 10, and this is my lowest score till now. It's 4 out of 10, because I mean, a lot of it was some of the anatomy I actually forgot. So yeah, that is obvious. So what was there in the topics that were there in this, okay, in question number 31 to 40. So the first thing was that there's something, I mean, the renal hilum relations, renal hilum, so renal hilum relations, okay, and then there was the posterior triangle, okay, like posterior triangle is important for this thing, for neet-pg also, and they basically asked which nerve is at particular risk of damage during the surgery. So this was one of the questions that I got right. So I'll just take up the question that I got wrong. There was something from cardiac anatomy. So just recollect that which embryonal arch basically gives rise to the left and right pulmonary arteries. So it's supposed to be the 6th. So I'm very weak at cardiac embryology. So this is like something that I will need to put it later on. I do have notes on it, but I don't have notes on this particular topic. Like, I'm very good at the septum formation and everything. Like, septum formation is okay, like it's particularly easy. Even the atrioventricular, I mean, whether it's the atrioventricular septum or whether it's the aortopulmonary septum, it's pretty okay. but then the arches are pretty, you need to connect it to little bit to, you need to connect it with the branchial arches and the aortic arches and then learn. So yeah, so this is something that I got wrong. The next thing is renal aldosterone mechanism. I mean, renal angiotensin aldosterone mechanism seems to keep on coming, okay, in this paper, and they love blood pressure. So I can understand that surgeons, if they had to know about one physiology, of course it would be about blood pressure and blood loss. So that's why it's so significant. Okay, so yeah, so this is something that I got wrong. So my physiology there is pretty weak. Okay, then there was something on vertebral artery, and the vertebral artery part, okay, they just where it arises from. Okay, so that was a very stupid mistake. I mean, I haven't done this portion up to now. And the next thing was this is something that maybe they can give in neet-pg even, or something like that. Like question number 36 of Fawzia sheet is basically, if I show this to you, just a second, wait, I think I'll come back to this later. Next, of course, there was annular pancreas. They tend to give a lot of questions from pancreas, pancreatitis, hypercalcemia, hypocalcemia. I mean, they love these parts. Okay, and this was a very interesting question. Like, suppose if someone is being someone with a head injury is being ventilated with intermittent positive pressure, then what would be the physiological consequence? So basically it I think it translates to decreased cardiac preload, because if positive pressure you give into the lungs are going to expand, and it is going to decrease the surface, I mean the volume of the heart or something like that. I mean, I just guessed it that way and it turned out to be correct, but I have to see what exactly it is. And they love the S1 dermatome. Okay, like the S1 dermatome supplies the lateral part of the foot. That is like their paid question. Okay, and even the types of gallstones. Okay, like if you see even the types of gallstones. So the interesting question that I really wanted to show you guys, because these are some, I think even if you get these questions wrong, I mean, this looks pretty inspiring. I mean, this is completely like, it's not those long type questions, out of the blue train of 4 kind of questions which marrow GTs give, but then it's pretty practical. I mean, you would be doing a gastrectomy somewhere down the line, and then after that you would be putting the patient on different kinds of fluids. So one of the core topics is basically one of the core topics of MRC is you need to know the different types of fluids that are given. And I feel so ashamed of the fact that even in internship we weren't taught about this so well, in spite of actually giving fluids so much. I mean, only little bit in gynae, because there was something called ringer infusion and ringer lactate. So yeah, so this is like one question which is so significant and so important. I mean, looks very important. Okay, and you could get it in a central institute exam or something like that. I mean, and it's pretty nice even. So basically they are like, there's the 65-year-old man, he's in the HDU, he has a gastrectomy, and then there are 3 days passes. You have the urine output, which is supposed to be 80 ml this much, and in 24 hours, and then you have one abdominal drain. Okay, there's no nasogastric losses, and everything means there's no nasogastric losses of the fluid or anything, and urea and electrolyte normal. He's nil per oral by mouth for 24 hours. So what are you going to give? Okay, so that is the question, what are you going to give? So Hartmann solution is something that I've heard about, but I really don't remember it. But then this much is certain of the fact that he needs some kind of glucose supply or something like that. So they answered dextrose, but yeah, this is something that I'm not going to crack my brains a lot on now. It will be after neet-pg. After neet-pg I will look up some of the fluids, because fluids, burns, all these things are very important topics. So I'm trying to make a division like this. I mean, like every 10 questions I do, I see which topic is basically repeated more than twice or more than twice in every 10 questions. Like every 10 questions I'm doing, that topic is coming up. So basically it's like a 50% probability of that particular thing coming up over there, something like that. Okay, so continuously, like I've done set of 10, 10, 10, 10, like 4 sets of 10 questions. Okay, 4 sets of 10 questions. All right, and you won't believe, okay, these are the topics that are repeated so much that even sometimes now I've literally learnt up that yeah, S1 is going to supply the lateral surface of the foot, I mean lateral surface of the leg and the foot. So S1 dermatome, that is, okay, peroneal nerve. So which are these topics, okay, that are continuously repeated in the 40 questions that I've done till now? Like they've actually repeated each and every all these questions. So pancreatitis is one. I mean, pancreatitis is an important topic even for neet-pg, especially, you know, you have Ranson's criteria and all that. Next is calcium metabolism, and I think sirs like Rakesh sir has this whole video on hypercalcemia. Okay, so it basically gives you a whole insight on the entire DD of hypercalcemia. So that is a very important topic. So basically calcium metabolism as a whole needs to be taken very seriously, because parathyroid is also important. Like you have these hyperparathyroidism and things like that. Next is thyroid, the neoplasms and everything, that is also very important. Every time they'll have one question from the RAS system, whether it's RAS related to shock or whether it's RAS related to something else. I mean, there has to be some question related to blood pressure. Okay, and especially even if you go to the core, it will be blood pressure related to the RAS system. And large bowel, anything that is like, you know, they have juvenile polyp questions on juvenile polyp and Pew-Jagger syndrome and things like that. And dermatomes, and especially the S1 dermatome, S1, okay, and the RAS mechanism. So these are like the topics that are continuously repeated. So I think that is the objective. I finished calcium metabolism while I was doing parathyroid and everything. So there are some stuff left in that, and I guess I'll take it up after some time. So that's said and done. Okay, we'll go back to doing diabetes, and I'll just revise everything that I studied today. Okay, because I have already forgotten most of the things that I studied today. I mean, whether it's MODI, what I studied in MODI, what I studied in type 1 and 2 diabetes, apart from the basic concept, I've almost forgotten everything. So I'm gonna continue with diabetes for this session, and yeah, let's see where it goes. Okay, and I think for this session I'll not be doing this part. I'll take the questions on I'll take the questions and I'll do the Q bank on complications. Okay, I'll do the Q bank on complications and then I'll come back to this. Okay, like I'll see which acute complication. I mean, there are so many complications in this, right? So I'll do the complications part, but before that also I think I should do the OHA part. I mean, OHA is pretty important. Okay, anti-diabetic drugs, I mean, they're so important, and I think I'll do the OHA and then I'll get into the complications and management. So yeah, let's see. OHA is something that I have to revise. Oh, this is pretty good. And see, this is the reason why you should keep revising. OHA I did on the 3rd of June. Okay, 3rd of June 2021, and I don't even remember that I did it. God. Okay, so let's see. I'll just go forward with the complication question module first, and then I'll decide whether I want to do hypoglycemic drugs or I want to do the complications part. And another thing that I guess I have to do is reviewing the questions that I took as my baseline, because that needs to be put into this. Either I'll do it now or I'll do it tomorrow when I'll revise again. So yeah, let's get on with this and let's try our best to see what can be done. Alright, so I'll just give you a quick review of what exactly happened in this session. So I solved a module on complications of diabetes. I mean, diabetes just has 2 modules in the medicine section. I mean, if you get into the medicine Q bank and see, my diabetes has about 2, and there are about 30 questions in the complications section, and it's very unbelievable, but around 16 questions from the past years is just from this topic. I mean, just from those complication videos. I mean, there are some pharma questions here and there, like always. So pharma is as usual very important, but then yeah, this chapter is really important. I mean, previously we got around 10 MCQs and now we are getting around 16, so that's like a total of 26 MCQs that has come, and that's a pretty big number. So complications and management, there were 30 questions and I managed to make 12 correct and 18 I got wrong. So my baseline, as usual, it's pretty bad. Okay, so but yeah, it's better than last time, I guess. I think so. Like, it looks better than last time because it's 36 percentile, and yeah, I got 40% of the questions correct. So let's see what are the important topics. The important topics, most of it has come from the chronic complications. Like, most of the questions came from chronic complications like nephropathy, retinopathy, macrovascular complications, dermatopathy, then emphysematous appendicitis, SGA. So all of this, okay, these are the chronic complications. And there were 2 questions from diabetic ketoacidosis and 1 question from the cardiac complications, and another 2 was SGLT2 transmitters and transporters, and another question was from metformin. So metformin and SGLT2 looks like it's very important because it was repeated in the previous module as well. And yeah, so nephropathy, retinopathy and macrovascular complications alone has about 10 questions. So 10 questions just from the chronic complications. That's a huge number. So what I did was yeah, so whole day of doing, morning evening diabetes, it becomes pretty exhausting. So I decided that I would do complications. Now, whenever you look at dirty notes, you always feel like deleting them, right? But then at the end of the day, you did some kind of hard work all those years ago, and this, for me, this was like December of 2019 when I wrote these notes. So yeah, I felt like deleting some of it just because of my handwriting, but then I chose not to, and I think I did the best thing by choosing not to delete. By just taking a step back, being non-judgmental and non-critical about myself, and just try reading the notes. That's what I tried to do. So yeah, a lot of it made sense, and a lot of it hasn't changed. So I'm very happy about that. So nephropathy, nothing has changed in nephropathy, and yeah, so I read through the notes and I just matched it up with the present notes as well, and I feel that this needs some some additions from pathology, okay, because there's a lot of histological images and stuff like that, and there were 1 or 2 points that I was missing out. That was in the treatment part and the indications of renal biopsy, hopefully. So yeah, that's that. Next, we come to diabetic neuropathy. So diabetic neuropathy was something that I hadn't done before, and I just read through it, and it's pretty self-explanatory, and there is a lot of correlation. You can correlate it to the physiology tracks and everything. So it's pretty much self-understandable. And the next thing was the skin manifestations. So skin manifestations, there are beautiful pictures, and initially they had just given the names, I think, and but then in this edition they even added the pictures, so it's pretty nice. I mean, there were questions also from the skin manifestations, so yeah, that is that. And the next thing, last but not the least, is the retinopathy part. So retinopathy part, I mean, diabetic retinopathy should be best read from OFTHA itself, because OFTHA would have more details in it. I just went ahead and added one or two, like I didn't even need to add points into OFTHA, because OFTHA basically had everything whatever medicine had. So you can just blindly go and read OFTHA, I mean read the retinopathy in OFTHA. So that's that. So yeah, there would be some supplementation for pathology into the diabetic nephropathy part, and that should do it. Diabetic ketoacidosis is a very exhaustive chapter. Like the acute complications require a lot of understanding, so that's the reason why I didn't choose to do it in the night, because I knew I would not be able to finish it, or more than that, it's like it would really take all my energy. And this chapter is more of, mugging up kind of a thing. It's not like very detailed, it's not very this thing. So that's why you can do it when you are light or something like that. And it's giving you 10 questions, man. 10 questions. I mean, just from the complications. That's a huge number. And yeah, you can actually go into the OFTHA part. Like here I'm in the OFTHA part. Okay. So you can get into the OFTHA part and actually try and correlate it with the OFTHA. Like non-proliferative and proliferative diabetic retinopathy. So yeah, then it will be completely satisfying, and you'll feel that yeah, you did it in toto. So that is done. Yeah, so neovascularization, everything is pretty self-explanatory, so this just needs to be revised, I guess. And tomorrow, I don't know whether I'll take up diabetes or not. Let's see what we have in store for tomorrow. So yeah, good night, and hope these suggestions would benefit you in some way. Maybe like it will save time. I mean, you don't have to look at the retinopathy in medicine. I mean, you can straight away go and study it from OFTHA. And I don't even think, Patho would have a very detailed account of diabetic nephropathy. So I'm going to breeze through Patho tomorrow, like literally breeze through it. And I will need to go through the questions. I mean, I still haven't reviewed the wrong questions of the 2 diabetes modules that I did today. So that is another work that I have to do. Okay, so let's wind up for the day, and hope that tomorrow will be even better.